Hello everyone, welcome to Nursing Pulse. Today we are going to practice some important multiple choice questions on midwifery. This will help you prepare for your nursing exams. First question, which of the following is hormonal cause of the onset of labor? There are three hormones are given. First is release of oxytocin, second is altered estrogen progesterone ratio, and third is prostaglandin. Total 3 options are given. 4 options are given. That is A, B, C and D. The correct answer is D. That is all 3 hormones. The onset of labor is not caused by just one hormone. It is combination of 3 important factors working together. First is oxytocin. This hormone is released from the brain and it tells the uterus to start contracting. Second is estrogen progesterone ratio. During the last week of pregnancy, estrogen levels go up and progesterone level go down. This change makes the uterus more sensitive to oxytocin. Third is prostaglandin. This substance is released from placenta and it helps to soften the cervix so it can open. So remember, all 3 hormones work together to start labor. That is why the correct option is D. Question number 2. Labor is called normal if it fulfills the following criteria except. Option A is spontaneous in onset and at term. Option B, with vertex presentation. Option C, modifying the nature of termination. Option D, without undue prolongation. The correct answer is option C, modifying the nature of termination. C. The normal labor has specific criteria according to the WHO. Let me tell you what makes a labor normal. First, it should start on its own without any medical intervention. Second, the baby should be in head down position, which is called vertex presentation. Third, the labor should not take too long. It should be completed within a reasonable time. Fourth, the delivery should happen naturally with minimum help and no complications to mother or baby. The option that says modifying the nature of termination does not fit in this definition. In normal labor, we do not change or modify how delivery happens. So the correct option is C. Question number 3. One of the following is the sign of true labor. Option A, irregular contractions. Option B, contractions felt abdominally. Option C, contractions disappear with ambulation. Option D, contraction associated with cervical dilatation. The correct answer is option D, contraction associated with cervical dilatation. The most important sign of true labor is that cervix is opening, which is called cervical dilatation. In true labor, the contractions are regular, they become stronger over time, and most importantly, they cause cervix to dilate. In false labor, the contractions are irregular. They are felt only in abdomen and they often stop when you walk or change position. So remember, if the cervix is dilating, it is the true labor. So the correct answer is option D. Question number 4. True labor is characterized by option A, effacement and dilatation of cervix. Option B, painful uterine contraction. Option C, suprapubic discomfort at regular interval. Option D, all of the above. The correct answer is D, all of the above. C, the true labor has 3 main features and all of them are correct. First, there is effacement and dilatation of the cervix. This means the cervix is thinning out and opening up. Second, there are painful uterine contractions. These contractions are regular and becoming strong over a time. Third, there is suprapubic discomfort at regular intervals. This means pain is felt in the lower abdomen at regular times. All three features together confirm that true labor has started. So the correct answer is option D. Question number 5. Which of the following statement is correct for true labor contraction? Option A. Begin irregularly but become regular and predictable. Option B. Often disappear with ambulation. Option C. Do not achieve cervical dilatation. Option D. Felt first abdominally and remain confined to the abdomen. The correct answer is option A, that is begin irregularly but become regular and predictable. True labor contraction follow a specific pattern. Okay, they may start irregularly in the beginning, but as labor progresses, they become more regular and predictable. You can time them and they come at regular intervals. The frequency increases, the duration becomes longer, and the intensity becomes stronger. In false labor, the contraction do not become regular. They disappear with walking and they do not cause cervical dilatation. So, the correct answer is option A. Question number 6. All of the following are features of true labor except option A. Bleeding cervix. Option B. Uterine contraction always present. Option C. No show of labor symptoms. D. Os progressively dilated. The correct answer is no show of labor symptoms. In true labor, the show is usually present. The show is a blood-tinged mucus discharge that comes out when the cervix starts to dilate. The feature of true labor include bleeding from the cervix, uterine contractions that are always present, and progressive dilatation of cervix. No show of labor symptoms is incorrect because in true labor, the show is typically present. So this is the exception. So the correct answer is option C. Question number 7. The characteristic feature of true labor is option A. Contractions not getting stronger. Option B. Pain felt in the front of the abdomen. Option C. Contractions continue irrespective of posture. Option D. Irregular contractions. The correct answer is option C. Contractions continue irrespective of posture. The most characteristic feature of true labor is that contractions continue regardless of your position or activity. If you walk or lie down or change your position, the contraction will still continue. They do not stop. In false labor, contraction often stop or lessen when you change position or walk around. Okay? But in true labor, the contraction persists with the same intensity. So the correct answer is option C. Question number 8. Which is a primary sign of labor? Option A. Uterine contraction. Option B. Abdominal contraction. Option C. Pushing by mother. Option D. Interthoracic pressure. The correct answer is option A. Uterine contraction. The primary and most fundamental sign of labor is uterine contraction. See, the uterine contractions are rhythmic, involuntary tightening of the uterus, and they become more intense, last longer, and occur closer together as labor progresses. They cause the cervix to dilate and efface, while the other signs like pushing by the mother may occur later. So, the uterine contraction is the primary sign. So, the correct answer is option A. Question number 9. When teaching a 36-week primigravida, signs of true labor, nurse will be sure to include option A, when she feels pain in the abdomen. Option B, when her pain radiates from lower back to the abdomen. Option C, when there is loss of mucus plug. Option D, when she experiences lightning. The correct answer is when there is loss of mucus plug. For a first time mother at 36 weeks, loss of mucus plug is a reliable sign of impending labor. The mucus plug is a thick jelly-like substance that seals the cervix during pregnancy. So, when the cervix starts to thin and open, the plug is expelled. So, this is called show, and it indicates that the labor will begin within next 24 to 48 hours. So, it is important to teach this to a primary gravida so she knows what to watch for. Okay. So the correct answer is option C. Question number 10. What is show? Option A, first fetal movement. Option B, expulsion of blood mixed with mucus. Option C, engagement of head. The correct answer is option B, expulsion of blood mixed with mucus. Show is the expulsion of blood mixed with the mucus from the cervical canal. When the cervix begins to dilate and efface, the small blood vessels in the cervix rupture, and this blood mixes with the mucus from cervical canal and is expelled from the vagina. It appears as a pinkish or a blood-tinged discharge. It is a normal sign that the labor is approaching. So the correct option is B. Question number 11. Which of the following is not a sign of actual labor pain? Option A, progressive effacement. Option B, pain confined to lower abdomen and groin. Option C, formation of bag of waters. Option D, dilatation of the internal os. The correct answer is option B, pain confined to lower abdomen and groin. See, the pain of true labor typically starts in the back and radiates around the abdomen. It is not confined to just the lower abdomen and the groin area. Pain confined to the lower abdomen and groin is a feature of false labor, not actual labor pain. In true labor, you have a progressive effacement, a formation of bag of waters, and dilatation of internal os. These are all signs of actual labor. So the correct answer is option B. Question number 12. False labor manifestation are as follow except option A, abdominal discomfort. Option B, contractions irregular. Option C, contraction lessen with activity or rest. Option D, cervix progressively effaced and dilate. The correct answer is option D, cervix progressively effaced and dilate. False labor, also called Braxton Hicks contraction, has several features. It causes abdominal discomfort. Okay, the contractions are irregular and the contractions often lessen or stop with activity or rest. But one thing is absent in false labor. There is no progressive cervical effacement and dilatation. The cervix does not change. Progressive cervical effacement and dilatation is a feature of true labor and not false labor. So the correct answer is option D. Question number 13. Braxton Hicks contractions are option A, painless uterine contraction during pregnancy. Option B, painful uterine contractions of pregnancy. Option C, painful uterine contractions of puberty. Option D, uterine contractions during fourth stage of labor. The correct answer is option A, painless uterine contraction during pregnancy. Braxton-Hicks contractions are painless uterine contractions that occur during pregnancy. They are often called as false labor. Okay, they are irregular, infrequent, and do not cause cervical dilatation. Most women feel them as a tightening or a hardening of the abdomen. They are usually not painful, just uncomfortable. Okay, so the correct answer is option A. Question number 14. Infrequent, irregular, and painless contraction felt on abdominal palpation during pregnancy are termed as option A. Braxton-Hicks contraction, option B. Quickening, option C. Osiander sign, option D. None of the above. The correct answer is option A. Braxton-Hicks contraction. Question number 15. Braxton-Hicks contraction start appearing at around option A 16 weeks, option B 24 weeks, option C 8 weeks, option D 4 week. The correct answer is option C 8 week. The Braxton-Hicks contraction begin as early as 6 to 8 weeks of pregnancy. They are present in all pregnancies from the early weeks. However, most of the women do not feel them until the second or third trimester because they are mild. They increase in frequency and intensity as the pregnancy progresses, especially in the third trimester. So the correct answer is option C. Question number 16. Client who is 32 weeks pregnant has just been admitted to the labor room in the first stage of labor. Which of the following clinical manifestation is considered abnormal and should be reported to the physician immediately? Option A. Expulsion of blood-tinged mucus plug. Option B. Continuous contraction of 2-minute duration. Option C. Feeling of pressure on perineum causing her to bear down. Option D. Expulsion of clear fluid from the vagina. The correct answer is option B. Continuous contraction of 2-minute duration. C. In the first stage of labor, the contraction have a specific pattern. At the beginning, they occur every 15 to 20 minutes and last about 30 seconds. At the end of the first stage, they occur every 2 to 3 minutes and last about 50 to 60 seconds. A continuous contraction of 2-minute duration is abnormal. This is called tetanic contraction and it can be very dangerous for the baby. It should be reported to the physician immediately. And the other option, that is the blood-tinged mucus plug, pressure on the perineum and expulsion of the clear fluid are all normal signs of labor. So the correct answer is option B. Question number 17. A client is admitted to the birthing suite in early active labor. Which nursing action takes priority during the admission process? Option A. Obtaining the obstetric history. Option B. Ascertaining whether membranes ruptured. Option C. Auscultating the fetal heart. Option D. Determining when the last meal was taken. The correct answer is auscultating the fetal heart. C. When the client is admitted in active labor, the priority nursing action is to auscultate or listen to the fetal heart rate. This is most important step because it gives immediate information about the baby's well-being. It helps you to identify any signs of fetal distress that need urgent intervention. And it also establishes a baseline fetal heart rate for monitoring during the rest of the labor. While the other assessments like obstetric history, membrane status, last meal are also important, but the fetal heart auscultation is the priority here. So the correct answer is option C. Question number 18. The factor responsible for the dilatation of the cervix is option A. Formation of bag of water. Option B. Painful uterine contractions. Option C, fetal excess pressure. Option D, all of the above. The correct answer is all of the above. C. Cervical dilatation happens because of three factors working together. First is the formation of the bag of water. The amniotic sac puts pressure on the cervix from the above. Second are the painful uterine contraction. They pull the cervix upward and cause it to open. And third is fetal excess pressure. As the baby descends, it presses on the cervix and helps to dilate it. So all three factors work together to dilate the cervix. So the correct answer is option D. Question number 19. Which of the following is a sign of true labor? Option A, irregular contractions. Option B, contraction felt abdominally. Option C, contractions disappear with ambulation. Option D, progressive cervical dilatation. The correct answer is progressive cervical dilatation. Question number 20. The normal duration of a full-term pregnancy is option A, 36 weeks. Option B, 38 weeks. Option C, 40 weeks. Option D, 42 weeks. The correct answer is option C, 40 weeks. The normal duration of a full-term pregnancy is 40 weeks. This is calculated from the first day of the last menstrual period. The normal range is considered 37 to 42 weeks. 36 weeks is considered late preterm. 38 to 42 weeks is considered full term. But the average and standard duration is 40 weeks. So the correct answer is option C. Thank you for watching Nursing Pulse. I hope this MCQ helped you prepare for your exams. Don't forget to like, share and subscribe for more nursing education content. See you in the next video.